Hey everybody, this is Dr. Daniel Choi here from North Texas Dental Surgery, Wisdom Teeth and Denture Implant Center.
And I'm Dr. Adam Bellingham from the Grapevine Dentist.
So today we're going to talk about patients might be complaining about dentures and why they don't fit.
Yeah.
So we'll talk a little bit about, this is a pretty common question, right?
Yes, we
Okay.
get that a lot.
Awesome.
People happy or unhappy with their denture, that kind of thing.
Right. Okay, so before we head into that topic, please give us a thumbs up, follow on our channels. I'm North Texas Dental Surgery.
And we're the Grapevine Dentist.
Yep, and we both have a YouTube and Instagram channel,
Yes.
so make sure to give us a follow. All right, so Dr. B, so we were just talking about this earlier. When a person's complaining about like why their denture may not fit, we can kind of break that into two different categories, right? There's
Yes.
what we call immediate dentures, and later on they're permanent dentures.
Yeah, they've
So
got a
could you-
conventional permanent denture.
Right.
Yeah.
So with me, doing surgeries a lot of times, and we're taking someone's teeth out, and then we deliver a denture at the same time. That's what we call an immediate denture,
Yeah.
right? Because you don't want to be walking around with no teeth for
Yes.
for 6 months. Well, some people actually don't mind,
Some
right?
people don't mind, but
Yeah.
most don't want to roll around with no teeth.
Exactly, right? So they want something in their mouth to at least like aesthetically be there. Now we know functionally they're not the best,
Yeah,
right?
they're not always that great. Yeah.
Right. But let's take a step back. Like we said that most people wouldn't want to go 4 or 6 months, but I went to school at Ohio State, and I remember one of our prosthetics instructors, he was always, he was an older guy, more old school. He was like 70 years old, but
Yeah.
he was like, no, don't do an immediate denture for a patient after their surgery. He's like, let them wait 6 months and then start getting the process started to give them a complete denture.
Yeah.
And then his whole rationale was because during that first 6 months of healing after you take teeth out, the bone is remodeling, changing shape, the gums changing shape. And because there's such significant shape, like changing a shape, that your denture that you would originally get would just 4 to 6 months later be useless, right?
Yeah.
So
Yeah.
like, quick example, it's like, imagine you had a surgery on your foot. They designed a shoe that they thought was going to fit properly, but now your foot is so dang swollen afterwards that it won't be able to fit in that shoe.
Yeah.
And then it starts to shrink significantly over that 6 months, and that's when you would get your custom-made shoe at that point, right?
Yes, yeah.
But we know that's not reality. Who the hell's going to go 6 months without no teeth?
Right,
Right?
yeah.
So, but anyways, yeah, I just wanted to kind of go over that real quick. But Dr. B, can you explain with like basically what the process is with an immediate denture?
Yeah.
What are the advantages? What are the disadvantages?
Yeah. So immediate denture is the idea that you don't want to go around with no teeth for 4
Right
6
after getting your
months.
teeth out,
Yeah.
right? Yep.
So you make it ahead of time before we actually do the surgery to take the teeth out.
Right.
So what we do is we do an impression on you while you've still got your teeth in.
The gooey stuff in your mouth.
Yeah, the big tray full of all the doughy goo stuff.
Yep.
Do the impression, and we give it to the lab. And what they're going to do is pour that up in stone, take that stone model, and basically just cut the teeth off, and then make a denture that fits that rough estimate. And they set the teeth on there, trying to get it about where your old teeth were.
So they'll send us something like this.
Yeah.
Right.
So it looks
Your
kind of like
denture.
that, and it's basically their best guess as to where the edges of the denture should be, how it should fit, where the teeth go, where the bite should be.
Right.
So it's all kind of a guesstimate. And so then when the surgeon goes in, say Dr. Choi goes in and takes all the teeth out, smooths out the bone and all that, it's not going to be the same as what that stone model was when we just chop the teeth off and make a denture.
Right.
So when we put it in, sometimes we get lucky and it fits pretty decent, but most of the time it's oversized, it wobbles
Yeah.
around, the teeth may not be exactly where we want them because it's just a best guess.
Right.
And so then we'll use a lot of times some soft filler material to kind of take that over, like if we're talking about shoes, take that oversized shoe and get it to fit, kind of like putting on a bunch of pairs of socks so you can
Yes.
you can hold your shoe on.
Putting a bunch of socks on or spray foaming the
Yeah,
inside
there
of the
you
shoe
go.
and then putting your foot in there.
We're doing kind of the equivalent of that, and its really sole purpose of that immediate denture is just so you've got something in there so you're going around
At least
without
smile.
teeth and smile and talk, and it's probably not going to chew that great, it's not going to look as ideal as you want it. Now there are times we do get lucky and sometimes it comes out great,
Yeah.
but that's not the norm. I mean, most immediate dentures are probably about 70% of the way there.
So I've been practicing, this is my 11th year of practice, and all over Dallas Fort Worth, I've been practicing at so many different practices over those first 6-7 years because I was a a surgeon, independent contractor
Yeah.
surgeon going to these offices, right? And so I would take all the teeth out and then smooth out the bone, suture the patient up, and then I would have a temporary, we call these again temporary or immediate dentures, right? Transitional dentures, whatever, like many different names for them.
Yeah.
And I would have some cases where I would have that denture and then I would then put it in their mouth and I'm like, is this the right denture for the right patient? Sometimes and then I'd be looking at the paperwork because the fit was so terrible. Sometimes people put it in their mouth and it's such a foreign substance. Right?
Yeah.
Now, sometimes it is just a foreign substance, so people are just kind of gagging what they can't get used
Yeah.
to it. But then other times, it is just the guesstimate might have been severely off, right?
There can be, and it will come from, say, people with really bad periodontal disease. The teeth are there, and there's a lot of gum, but they've lost a ton of bone.
Right.
So when you take those teeth out and all those gums collapse because they don't have the teeth holding them up,
Right.
there can be some really significant changes
Right.
between what it looks like on a stone model and what that actual underlying bone structure is.
Right.
And you can get ones that can be so off that they fit the model that cut all the teeth
Right.
off, but there was such a discrepancy between where the teeth were holding tissue versus the underlying bone support that the
Right.
tissue then falls down to,
Right.
that it almost seems like it's another person's denture.
Right. So bottom line, let's say that it doesn't fit well, which most times it doesn't really fit well.
Yeah.
Right. That's the reality with immediate dentures. We always try to set expectations.
Yeah.
It's funny because with me setting patients' expectations, whenever I tell a patient that they're going to later get a regular denture or whether they're going to get a snap-on denture or something like that, well, that 4 to 6 months that they're wearing a regular denture, I tell patients, hey,
It's going to be rough.
yeah, you're going to hate me.
Yeah.
This thing is going to suck. And the thing that sucks for us is even if we do as good of a job taking that mold of your mouth and then sending it to the lab and me having been the guy that takes out hundreds of thousands of teeth, when I'm taking those teeth out, what your bone, the infections in your bone, how the bone collapses in certain areas, even if I try to smooth out the bone, a lot of that is very unpredictable with many of the surgeries that we do.
Yeah.
So that's where some of these things can happen. But anyways, we got to the point. Let's say that, we get this thing, we put it in the patient's mouth, it doesn't fit well, and you just talked about it a few minutes ago. You said we soft reline.
You can do
right?
what's called a soft reline,
Right.
where we have some material that we mix up, and it's kind of a soft, kind of squishy consistency, and we put it in the denture and seat it as best as it'll go,
Right.
and we let that set up, and it's a space filler.
Right.
And we use that and periodically swap it out through this healing process, because
Right.
as the tissue swelling goes down and bone is steadily reshaping and remodeling over those 4 to 6 months, the fit's going to change.
Yeah,
And that's
dramatically, right?
Yes,
dramatically.
very. And
yeah.
that's why we'll use that soft liner when it, after month 1, it starts getting real loose again. Okay,
Right.
we strip that out, put new in,
Right.
and we continue to do that until we get to a point where the bone gets fairly stable.
Right.
And we've typically found that about 6 months out is where a good 95 to 98% of bone remodeling is stabilized.
Right.
And then you're pretty much safe to move on to the next step
You're
of
right.
making a final version.
Now, over the next decades of life, too, though.
Bone is always changing shape in our
Right.
body, always, and all throughout our whole body. And the same thing happens in the mouth. So
Right.
no one denture will fit perfectly for forever,
Right.
because things are always changing.
Right.
But it will be much more stable. It's not going to be, oh, I've had this for a month and it no longer fits anymore dramatically. It'll be years before it's like, well, it's not as snug as it used to be.
Right. Now, another thing is the fit, but also another thing they'll talk about is how well it's sticking inside their mouth, right?
Yes.
So what can they do about that?
For in the immediate zone where we're still letting everything heal, it's just frequently swapping out that soft liner. And once you've made it past to where your extraction sockets or sutures or whatever out and have fairly adequately healed, you can use any kind of denture adhesive. It's really kind of where you're at.
What's
for
the
that
danger
kind
of
thing.
using it from day one?
Day one, mainly if you've got sutures in there, you don't want to yank those back out,
Right.
because this stuff is
It's kind of sticky.
it's sticky and it's kind of smushes everywhere, and then you don't want to get foreign bodies into those open extraction
Right.
sockets, because then you can get infection or lots of swelling, And we want to keep those clean until we've got nice, good, solid clots in there that we don't have to worry about dislodging.
Right.
And if you did put it in too early and you pulled out some of those clots, then it's a dry socket.
Right.
And that can be real uncomfortable.
So bottom line is, like, if you use the denture adhesive way too quick, like in week 1, then you're gonna have a lot of pain one way or another.
You can end up with like dry sockets or infection, that kind of thing.
And it's during that time anyways that you want to be on a super soft diet, so like you shouldn't really have to like try to function too much with your dentures. I really hate to tell this to patients, but really that immediate denture is more for aesthetics.
It's really just for looks.
Yeah.
It's not gonna do a ton of functioning.
Yeah. When patients sit there saying like, oh, like I can't really chew with these, and they're like, yeah,
you're kind of not going to, and it's just the nature of the beast. The fit's not gonna be great. You've got a bunch of open extraction sockets, gonna be sore. They're not. I mean, I'm always honest and upfront with patients about immediate dentures. I'm like, it's going to be a rough 6 months.
Yeah.
They're not comfortable. They're not like, don't get discouraged. You know, the final version's going to be much better, but it's going to be a tough 6 months.
Right.
It's got a lot of healing, and you've got something in there that doesn't fit that great.
I mean, really, it helps kind of explain to patients too the value of holding onto your teeth.
Yes.
I mean, to give you a quick analogy, it's losing your teeth and then replacing it with a piece of plastic that looks like gums and teeth. I mean, this is a prosthesis. This is no different than losing your arm and trying to live with a prosthetic limb.
Yes,
very
very
plastic
true.
limb. And like how life-changing would that be?
A denture is not, teeth are rooted in bone. A denture is just held in with adhesive and suction.
Exactly.
I mean, it's not going to chew and function the same as
And
teeth.
there's also a difference between the upper and lower, right?
Yes.
So can you explain a little bit about that?
Yes, so uppers typically are easier to get used to and tend to fit a little better because nothing really moves up top. You do have some lips that move, but your palate doesn't go anywhere.
Right.
And so the
palate,
borders,
the roof of the mouth.
Yeah, the roof of the mouth.
Right.
So when you do put it in, you typically get pretty good suction, and if you use a little bit of adhesive, it sticks up there pretty nicely. Well, the lower is a different animal. Your lower lip moves a lot more than your upper. Also, your jaw moves all the time, and one entire part of the edge of your denture is against your tongue.
Yeah.
And your tongue is constantly moving around the floor of your mouth, lifts and shifts as you talk and move. So you can't get suction on a lower because imagine trying to put like a suction cup on the table, but half of it's hanging off the end and flipping around. You'll never get it to stick.
Right.
So lower dentures are basically held in by adhesive and gravity.
Right.
And it's honest. It is what it is. Lower dentures are much more difficult to get used to.
Right. So basically, lower dentures suck. I mean, in general,
I mean,
right?
in honesty, they do.
And then immediate dentures also kind of suck.
Yeah.
So lower immediate dentures are just terrible.
Yes, they are quite a challenge for the patient to deal with.
They are, right? So I even tell patients sometimes, like, I don't know about you, but I tell them, like, listen, if you don't have an aesthetic concern, and now is the day of COVID, like it is late August 2021, people still wearing masks sometimes. I mean, if you could go like a few months without even wearing it immediate, like I was like, you might even like save yourself the money or like the pain of having
or
to
just do an immediate upper.
Yeah.
And because those at least are what most people notice. So if you smile,
most people don't even notice your lower teeth.
Yeah, a lot of times you can get away without doing an immediate on a lower, and it will be much more comfortable.
Yeah,
for the
depending
patient.
on age too, right? Older people show less teeth.
Yeah.
So that's another thing to consider. So you could always talk to your dentist about that. But there's certain ways you can save yourself the money, because I hate to tell patients too, like, again, letting them know about expectations. I don't want you to think that this is going to be an amazing set of teeth.
Yeah.
It is completely meant to be a transitional, temporary thing.
Yes.
Because later on you're going to get your complete denture, right? Your
final
finals,
version.
right? Okay.
Yes.
So tell me why, if you're telling me that your immediate dentures suck, tell me why like the final dentures are going to be any better.
So with finals, we've got a ton more control over every aspect of the denture.
Now you waited 6 months
We've
too.
waited 6 months. Bone is much more stable. When we do that, we do multiple rounds of impressions for accuracy, and we've got a whole slew of steps, and so I can go through those. So typically making a immediate or a complete final denture is a 4 to 5 appointment deal. It's not
to do it right.
Correctly. Without cutting corners, and to try and get the most accuracy you can get. So the first time I see you to make that final one, we're going to do our initial impression, which is a standard kind of one size fits most tray with impression material. and that's going to get you a pretty good impression.
Right.
But what we're then going to do, because the goal, how you make an upper denture have good suction and fit, half of it is the anatomy of your mouth. Some people are easy to get suction on. Some people just have a shape of a mouth that's never going to get that great a suction.
Yep.
But we can get good stability.
Right.
So, but you need accurate impressions for that. The more accurate you can get, the better your stability is going to be.
So you were just talking about like the two, like, so there's like a few main things about the denture that you got to be concerned about. It is like basically the support, or like kind of staying in there, or suction, right? Yeah. Suction, staying in place, not letting gravity make it fall out, but then also stability, so it's not like wobbling all the
when
time.
You do chew vertically on it, it's not flip-flopping around on you because one side's lower than the other. There's a big gap on one side.
Right.
We want, when we push on those teeth on the upper, it's solid and fairly stable.
Right.
So we'll then, off that first, impression that's pretty accurate, but not as accurate as we want, we're going to have the lab make a custom tray. So it's going to be it'll only fit your mouth, and is designed that our impression material is going to be uniform thickness all the way through to get the most accurate impression we can get.
Right.
And we're going to do that second impression. Then the next step is I have what we call them wax rims. And it's going to look like a temporary denture with a big horseshoe of wax on it for the top and bottom. That is how we try these in, and we melt down and cut and shape that wax to simulate where those teeth should go.
Right.
So you're not too far open, too far closed. We're not giving you big old buck horse teeth.
Right.
We're not setting them too far back, that kind of deal. But the goal is to set them where your natural teeth should be, and get the height correct of upper and lower, so it doesn't look like you've either got too long upper teeth, too long lower teeth, and that you can function, because you have to set those teeth in the right place of the mouth so that you can speak and chew normally.
Right.
And so that's where that is the guide for. Then I do an aesthetic check, where I will actually have the lab put the actual teeth we're going to use into that wax, so that then we try them in. And that way we can, make sure that the height of the bite feels good, all the teeth are interlocking like they should, and that they look the way you want. Some people want everything to be the perfect Hollywood, perfect setting smile. Some people want a little character in their teeth. Some people may want a little gap between their two front teeth, or they want to match their old natural teeth, where they want this, lateral turned a little bit, or this. Yeah. That is where we can really customize them to exactly how you like them. Because it's in wax, I can infinitely move those teeth around anywhere we want, chair side, so you can try it in and be like, well, this one looks a little shorter, can we move that one? Sure. Move it down a little bit.
So that appointment is very important, because they gotta, they can't just tell you how they think they want it, and then
you have to see them on you and in to know.
You don't want to make it in plastic and then suddenly give it to them. It's like, wait, that's not what you wanted. Then
you got to completely start from scratch.
Yeah, so that step is super important.
Yeah, it's that final check to get everything that we'll know, hey, this is how our final product is going to look.
Right, okay.
And then we turn it into the real thing.
Right, and we'll talk more about aesthetics of dentures in another video, but so fit. But I want to say one thing is me being a periodontist, and obviously I don't make dentures, myself, but again, having worked at so many dang different offices over 7 years, my first 7 years of practice. Yeah. But a lot of places can cut corners.
Yes.
Yeah.
Yes, they can.
Discount dentures and implant centers and all these things. A lot of discount, and even regular dental offices too.
Yeah.
I mean, you're actually doing it the way we learned it in school. Yeah. Right.
And I pretty much stick to the traditional way because it gets you the best results.
Yeah. I mean, wow, that's attentive to detail. It's, there's a lot of things in life basically that if you want to get it done right, you have to go through the necessary steps.
And we know everybody wants their teeth as fast as possible, and we understand that. And we know that, 5 appointments with some lab time in between takes a while. Right. I mean, it's probably from start to finish, probably about 2 months. Because each appointment is anywhere from 1 to 2 weeks in between. There's 5 of them, 10 weeks at the most. Most of the time we do get stuff back faster.
But this is your set of teeth the rest of your life, though.
It's one of those, when you, just like anything, you can do things fast and efficiently, but when you start skipping steps,
Right.
you're making compromises.
Right.
And you're either going to make compromise in fit or
Aesthetics.
compromise in aesthetics.
Right.
And most people want fit and aesthetics. And the only way to do it is you have to take the time to do the steps.
Right.
Because if you don't do a final impression in a custom tray and go with just kind of a generic impression, will it fit? Yeah. But could it fit better? Yes.
Yeah.
If you don't do an aesthetic try-in, will it come out looking pretty good? Maybe, probably. But is it going to be exactly what you wanted? And if something doesn't come out the way you think it is, and they say the lab, I don't know, messes up and sets one tooth crooked, well, then we got to start from scratch. And then it's you didn't save any time.
Right.
You could have spent 2 months to get it done exactly how you like it, or you saved an additional 2 to 3 weeks, and now we got to start all over.
Yeah.
And now it's a 3 to 4 month till you get your final one.
Right.
I don't like having to redo stuff. I like to do it once the right way, and make sure that it's done how the patient likes it.
Yeah. Well, thanks for all that information.
Of course.
So, yeah, basically, if your denture's not fitting, again, to sum it up real quick, is it an immediate denture that you're taking that's, immediately after we take out your teeth and we're putting something in there? Then, quick answer on that.
It's probably not going to.
Yeah, I don't want to use that as an excuse for any dentist or a lab that they can slop together a denture, because I've seen some atrocities also.
Yes.
But in general, even if we try our hardest, it's very hard to get that to fit very well.
Yeah.
Some strategies that they can use, soft reline material.
Yeah, reline
right?
material.
It's like spray foam,
Yeah,
right?
yeah.
If I could spray foam,
Awesome.
use a little spray foam from the garage,
Some good adhesive
right.
will help with some of that.
Right.
To an extent, depending on how poor the fit may be.
Right.
But in a final version, if we're talking about now final,
right.
then it's kind of attention to half of it is attention to detail, how well the denture was made.
Yeah.
But there is definitely a portion of just your particular anatomy.
Right.
I've made thousands of dentures on thousands of different people.
Right.
And some people, it's slam dunk easy to get a denture that just fits amazing.
Right.
And some people, if they have a short ridge or various other reasons.
So they lost too much bone over the years,
Yeah.
and they're trying to get another denture.
Or they've got a really high V-shaped palate or some unusual shapes in their anatomy. Getting really good suction is just probably not going to happen. You're going to have to use adhesive.
But you would be able to tell them that,
yes,
at the get-go.
Most of the time, we
Right.
can take a look in there and give you an idea of, hey man, this is going to be slam dunk, it's going to be awesome, and we might have a little bit of challenges here, but we can definitely get you good stability.
Right.
And we just might have to augment that suction or retention with a little bit of denture adhesive.
Right. So basically, why your denture, your final denture, the one that you're planning on being your permanent denture, just make sure that your dentist is going to go through the steps. There's some dentists that are going to take one mold of your mouth and make a denture.
Yeah.
There's some people that don't care and they want to pay the cheapest price possible, but that might come at a compromise. It might not look the way you want it to, and it might not function the way you want it to.
Yeah.
You might not get the retention and stability you could have gotten had you gone through the necessary steps. So everybody's different. Some people are totally content getting a car that is not what they want it to look like or function.
They just
have
need
good
something
performance.
that transports them from A to B, and some
Exactly.
people just want something that'll let them chew. They don't
Exactly.
really care what it looks like.
Some
Just,
want-
can I chew?
Right, some want something that can look good. And here's the beautiful thing about dentures: you can use high-end teeth, different types of acrylics, like you mentioned, and you could have a set a denture that looks amazing, and no one, even dentists, wouldn't even know that's a denture. So actually, let's talk about that in another video too. But
Sounds
anyways, hope you guys enjoyed this video. If you guys have any questions, please feel free to leave in the comments below, and also give us a thumbs up and follow our channel.
Yeah.
Thank you.
Thanks a lot.